Coming up on Innovations, learn how leading immunologists are transforming our understanding of health and disease. Join us as we travel to Brazil to explore the latest breakthroughs in tissue regeneration. Take a behind-the-scenes look at the world of digital advertising. And the latest advances in science and medicine bring new solutions for orphan diseases. All ahead in the next half hour.
I'm Ed Begley Jr., and welcome to Innovations, an educational series dedicated to informing the public on the latest advancements and breakthroughs taking place across the globe. Throughout this series, we'll explore the significant issues impacting our lives today and discover how we're preparing for the future.
The immune system is central to our health and well-being. It is the body's defense against infectious organisms and other invaders. Through a series of steps called the immune response, the immune system attacks organisms and substances that invade our systems and cause disease.
The immune system is central to our health and well-being because it protects us from many infections. Immune cells go everywhere in our body, patrolling to keep us free from infection. However, immune cells sometimes over-respond and cause what are called autoimmune diseases. And these can target many different organs, for example, the pancreas in type 1 diabetes or the joints in rheumatoid arthritis.
Immune system research will dramatically change the healthcare landscape. Understanding this amazing system will let your doctor take a complete look at your individual health. Your immune system tells us what keeps you healthy and may even predict what might threaten you in the future. More than ever, research is developing new tools and an engineer's understanding of the immune system. The newest therapies need not work for everyone, but for you, they'll work just perfectly. A reasonable future is going into your doctor and saying, "Doctor, what is it just for me that will make me feel well again?" And based on precise measurement and computational methods now being developed in the lab, medicine is personalized for you in the clinic. Understanding the immune system really gives us that future.
The La Jolla Institute for Allergy and Immunology, or LJI, is one of only a handful of research institutions who exclusively focus on studying the immune system.
The La Jolla Institute is a research institution, a research organization dedicated to improving our understanding of how the immune system works. And by doing that, we believe that we will have a very positive impact on human health and well-being.
At the Institute, 24 world-renowned immunologists act as catalysts for discoveries that are transforming our understanding of health and disease.
The scientists at the La Jolla Institute are transforming our understanding of health and disease through areas that historically have been part of immunology, such as improving vaccine development. However, they're also at the forefront of our understanding of how we can train the immune system to fight cancer and how the immune system contributes to chronic inflammatory conditions like heart disease.
While vaccines are amazing medicine, in the past they've been created through diligent trial and error type creation. Current research on the immune system is showing us how vaccines can be made in more of an engineering cycle to understand how your immune system reacts to various things that it might be challenged with. In this way, we can design vaccines with the knowledge and safety so that when they're administered, we know they're going to work and we can develop them faster.
The concentration of intellectual prowess and ingenuity, combined with the latest biomedical tools and technological resources, has established LJI as one of the world's premier research institutes in the field of immunology.
The La Jolla Institute is a premier research institute, full stop, not only in immunology, but in science in general. This institute has brought together some of the most ambitious and creative scientists in the world, people who actually know how to work together. The management has created the environment where they want to work together. That, coupled with the La Jolla Mesa, where they have other collaborators, is such that there's nothing else like it in the world. They're a wonderful institution.
In addition to having the world's largest open access database, detailing what the immune system sees and how it responds, LJI also leads a unique effort in human immune profiling.
Human immune profiling is the study of the changes that happen in the white blood cells as a result of the attack on the body represented by disease or infection. Each disease or infection has specific changes, and we can tell which genes are turned on and off. And this is important to be able to reproduce those changes to develop very effective vaccines or treatment. It's also important to be able to tell ahead of time which individuals are at risk of developing the more severe disease.
The overall goal is to provide a comprehensive understanding of the immune system and its regulation, to gain insight in what constitutes a protective immune response, and how to design preventative and restorative therapies, including more effective vaccines.
When we achieve a better understanding of how the immune system works, it will have an enormous positive effect on human health. Think of vaccines, for example. When we have a vaccine against HIV, tuberculosis, malaria, and Zika, think of how great the effect will be on human health. And by the same token, all of those autoimmune and inflammatory, destructive immune responses, if we could prevent them while maintaining normal immune function to prevent infection, think of how great the effect will be on human health and well-being.
Right now in the research lab, exotic instrumentation captures massive amounts of data, revealing in splendid detail how the immune system works. The trend is to move this ultra-precise examination of the immune system into the clinic, and that is going to transform the way we improve human health. Knowing about you in great detail, those therapies and preventative advice you get are going to be tailored perfectly to you. Fortunately, this trend is not going to stop. When we expand our knowledge through research, we transform medicine. We transform the whole process of staying healthy too. With the rapid pace of discovery, this revolution is going to be similar to what we saw with powered flight, where 65 years after the first flight, we were on the moon. And it changed our world and what it means to be human. The same is happening in medical research. With new technology at our disposal, research in a single lifetime is going to redefine early diagnosis, successful treatment, and disease prevention.
For more information, visit www.lji.org.
Currently, cardiovascular disease affects more than 1 in 3 American adults. As science and technology continue to advance, so do the treatment options available. Watch as we explore the ever-changing world of science.
Cardiovascular disease is the leading global cause of death, accounting for 17.3 million deaths per year.
When a patient needs heart valve replacement, basically they have two options, which are biological valves and mechanical valves. The main drawback from mechanical valves is that the patient needs a permanent anticoagulation for the rest of his life. That means that he needs to go to a lab every month just to check if his blood is really thin enough and protecting him for having thromboembolic event and not strong enough to have a bleeding event. So that impacts the quality of life of those patients. On the other hand, biological valves give a better quality of life for the patients. However, they don't last forever.
Established in 2006, Tissue Regenix is a leading medical devices company in the field of regenerative medicine.
Tissue Regenix is a regenerative medical device company. We're based in the UK. We are developing a range of decellularized devices, which essentially look to replace damaged or diseased tissue with a scaffold that regenerates inside the patient.
D-Cell is a novel, safe, and cost-effective treatment for chronic conditions. It allows the patient's own cells to build upon this scaffold and regenerate like-for-like tissue without the risk of rejection.
D-Cell is the core technology, the patented technology that Tissue Regenix is commercializing, and essentially that's a way of taking tissue, be it animal tissue or human tissue, removing the cells, removing the DNA, removing all the things that the patient's body might reject when it was implanted into them, and providing it with essentially a blank canvas. So once it's put into the body, the patient's own cells re-infiltrate that and it becomes a living piece of tissue with the patient's own cells in it. So essentially what we're providing is a long-term living repair for the patient rather than a piece of metal or plastic, which is where technology has been for the last 30 or 40 years.
When you implant a homograft, which is a human valve, normally tissue banks are still using cryopreserved allografts. Cryopreserved allografts comes with the donor cells, which are immunogenic, causes some kind of immune reaction, which has impact on the durability of these allografts. If you decellularize a tissue you take all the cells out. You're only left with the extracellular matrix, which is immunologically inert, and we have proved that in patients already. So what happens is that those decellularized allografts, they are much better incorporated by the host, and the durability will be longer. We could even see that the patient's own cells will repopulate that graft, making it a kind of a living graft.
When the physicians start to implant these kind of valves, they were very happy with the results. And what's good is that we don't need to use liquid nitrogen freezers anymore, and we don't need cryo shippers anymore.
With the D-cell, you know the size of the valve, you know the length of the valve, and the valve is ready to use. So a big advantage of the D-cell is that you don't have to defrost. So you can shorten the operation time, and more importantly, you can shorten cross-clamp time, which is the time where the heart needs to be protected. So every 5 minutes or every 10 minutes is important at the end of the operation.
When the doctor told me I would have to go through surgery, I was really scared because I've never been through any kind of surgery, always had a healthy and calm life. So I got scared. Scared especially because I didn't have any symptoms. After I had the procedure, I felt a lot better. I knew I was fine, that I could get pregnant. That was what I wanted the most, and to have a good life with my son.
Currently, this technology is being used in the treatment of pediatric heart valve disease in Brazil.
In Brazil, unfortunately, we still have a lot of rheumatic valve disease, so we still have many patients needing a aortic valve or pulmonary valve replacement or mitral valve at very young stage in their lives. And more importantly, patients who had operations for congenital heart disease at a very early age in their lives, they are coming back needing a valve replacement when they are 20s or 30s. So the D-cell technology will be amazing for those patients.
If you look at the kids who received the heart valves in Brazil, they've been implanted in children and they've allowed those children to develop and grow normally, have active lives, do all the things that kids want to do, but they've gone from kids who are 1 year old to now 10 years old or 11 years old, and those valves have developed with them. That to me is the ultimate power of this technology. D-cell has the capacity to adapt, grow, regenerate, do all the things you'd expect your own body to do, but we're just providing a scaffold that allows the patient's own cells to do all those things.
To date, more than 500 children in Brazil have received a D-cell heart valve, allowing them to return to a normal quality of life.
I like to play with my sister, play games, play with my friends. I like to play dolls with my sister. I like the ballet with my friends. It's really fun. With this treatment and the surgery, it allowed me to run more, attend gym class, jump on the trampoline, which I couldn't do much before. I also feel a lot less tired.
Patients want to have a normal life and be free of reoperations. And if you can use a decellularized allograft, which now we have been seeing through many of echo studies and CT scans that these valves are performing better, I think in most of those cases, the operation will last much longer because of these technologies.
As the years go by, I feel more confident that I can do things like everyone, and I am not different. I feel more comfortable after the surgery and the treatment.
I'd like to say to other women who might be in the same situation as me, who have the dream of getting pregnant and also have this problem too, absolutely see if you are a candidate for this procedure, because you will have a new chance at life. So my advice is to ask your doctor and get the procedure.
The D-cell technology can basically be used to replace any diseased or damaged piece of soft tissue. So that goes from wound care, for instance. The product we launched in the United States, Dermapure, is to treat chronic wounds, diabetic foot ulcers, venous leg ulcers, a massive problem, a $1.4 billion market in the United States alone. And we're also using it to treat sports medicine injuries. So we have products that basically address injuries of the knee. So NFL players, for instance, they're always busting their anterior cruciate ligaments, their ACLs, and we've just literally started a clinical trial in Europe that seeks to provide a natural regenerative replacement for those types of injuries. So from a perspective of, what can it do, it's more important to say what can't it do. D-Cell's not about future stuff that's going to be around in 15 years' time, it's about products that are available now. And in the case of the patients in Brazil who've received the decellularized heart valves, we've got very real evidence. We now have 10-year data that supports the use of those products in the types of patients that they've been used in. So it's not just a wish list, it's not just a future technology, it's technology that's available now, it's being used with real people solving real problems.
For more information, visit www.tissueregenix.com.
Digital technology brings continuous innovation and is changing almost everything about the way we live. Watch as we explore some of these technologies that are revolutionizing the industry.
Today, the internet plays an integral part of everyday life. Media and contemporary communications have in many ways reorganized time and space for users and audiences.
Well, the biggest change with digital media is that it makes it easy for anyone to be a content creator and to get people to be able to find and discover and enjoy their content. Historically, anyone could produce content, but getting it distributed was hard. The web made that easier and sort of democratized media distribution. And as a consumer, you have access to an unprecedented choice of media, and the chance that you can find someone creating content that's aligned with your passion is very high.
As a global leader in applying the power of big data and analytics to digital and mobile advertising, Quantcast was founded to help the world measure and understand digital audiences.
Quantcast is a data technology company. We help publishers understand the audiences that consume their digital content, and we help advertisers reach just the right people for the products and services that they offer. We do this by processing enormous amounts of data with a technology called machine learning that can understand the underlying patterns of consumers across digital media and organize that in a way that's useful for publishers and advertisers.
The measurement of how many people and who are they is crucial for making the advertising industry work. Quantcast Measure is a different way of doing that. It's a better way of doing that. Traditionally, both in the offline worlds of TV and magazines and newspapers, people have used what's called a panel. They take a small number of people and they track exactly what TV shows they're watching, what newspapers they're reading, what radio stations they're listening to, and then they project that on the entire population. It's a process that at an aggregate level works okay when you've got no better alternatives, but it is rife with inaccuracies. Quantcast Measure, which has been around for now almost 10 years, takes advantage of one clear fact about the internet, which is you can actually measure directly from the publisher's server exactly how many hits are happening. So you can be far more accurate. And that's a technology called direct measurement that Quantcast pioneered about 10 years ago.
By building its own adaptive modeling and machine learning technology, Quantcast can uniquely identify human behavioral patterns at scale.
Machine learning is a branch of computer science which is concerned with how we get computer systems to spot patterns or respond to inputs by learning from examples rather than being pre-programmed with an explicit set of rules. So in our field of what's called programmatic advertising, the actual advertising that we see online is auctioned in real time. Each spot is auctioned as the web page is loading. So we have to deal actually with millions of these decisions every second. And what we're trying to do is to make a decision as to whether a particular spot will be relevant for a given consumer. And that's where the machine learning can be so powerful. Imagine we're helping a travel client. One of our customers wants to be able to promote travel to San Francisco. And we want to understand the reasons why people might travel to San Francisco. And as an example, for a particular advertiser, our systems were able to discover an unusual pattern where there were lots of people interested in dentistry traveling to San Francisco, which on the face of it would stand out as not making much sense, but actually turned out that there was a big annual convention for dentists at the Moscone Center, the convention center in San Francisco. And these are the sorts of patterns that these computer systems can pick up. Not just one pattern for a given outcome, but hundreds, thousands, even tens of thousands of different patterns that when pieced together provide a very significant, very accurate audience for that advertiser, and of course are creating relevant, useful experiences through advertising for those consumers.
The company works with the majority of the at-age top 100 brands, over 50% of the top 1,000 publishers, and powers advertising in 29 markets around the world that deliver accuracy at 30% above its competitors, as reported by the Wall Street Journal.
Well, actually, it's between 30 and 50%, depending on exactly what targeting we're talking about. But the reason we do is actually pretty straightforward. So I've got a 5-year-old daughter, and she's just getting into the stage where she loves to do connect the dot puzzles. And what I've noticed is that the more dots in the puzzle, the faster she sees the pattern, and the quicker she completes the puzzle. What we're able to do at Quantcast, and the reason we're able to do it with more accuracy and greater speed than any of our competition, is pretty much analogous to the same thing. We have more data from our partnerships with over 100 million online destinations, and therefore we see more dots. And because we see more dots, our ability to see the picture both more clearly and more quickly is driven off of that. So it's the size of the data set that we've got that allows us to see the pattern, which allows us to show ads that are more relevant to any given consumer, which makes them more likely to respond. So that if you were to look at the weather in Hawaii now, we would be serving you an ad 1 to 2 seconds later that is relevant to the fact that you just looked at weather in the city that's not your own. That's what makes Quantcast Advertise special. It's a product to serve advertising in this real-time environment, but because we have more data, more accurate and more real-time, the ads we show are more relevant to the consumer and therefore more effective.
Quantcast is driven by the potential for big data to radically improve connected experiences and continually transform the way we make sense of the world.
When Quantcast was founded, this currency that you require to trade advertising, that advertisers and media owners need to be able to understand how many people are watching, who are they the right audience, that's in effect a currency. Quantcast was founded on the idea of democratizing that process. If you can use a simpler, more accurate process for measuring and developing that currency, then millions of sites, not hundreds of sites, could get themselves measured and therefore in turn could sell advertising to all of our favorite brands from Madison Avenue and elsewhere. And that's the journey we are on. How do we democratize measurement, and now how do we democratize the actual serving of advertising so that everyone from the largest advertisers to tiny advertisers who are basically operating out of their garage, they can now sell their products and services. They can spend as much as they can afford and they can build from there. And that is what's possible in the age of democratized media, and that is something we as a company have always been committed to enabling.
For more information, visit www.quantcast.com.
Advancements in technology and medicine provide more answers today than ever before. Living at the forefront of technology, our knowledge will only continue to grow and teach us how to sustain and live healthier, longer lives.
Each year, orphan diseases afflict millions of individuals around the globe.
Traditionally, the big pharma companies have developed medicines for the treatment of prevalent large diseases. You have the cancers, you have the cardiovascular diseases that affect millions of patients. That means that there is a large population of patients suffering from rare diseases, or what we call today orphan diseases. These diseases have basically not received interest from big pharma companies over the last 30 or 40 years during all the medical boom. The diseases are very severe, and since there is no current treatment available because nobody has developed treatments for them, they are diseases with a very, very high unmet need.
Orphan diseases have not benefited from the biotechnological efforts and consequent breakthroughs witnessed for other, more common diseases. Recent statistics show that 95% of rare diseases do not have a single FDA-approved drug treatment.
Rare diseases per definition affects few people, and traditionally, of course, in the big companies, drug development has been driven by large market opportunities. So from an academic and from a patient standpoint, there has been a tremendous amount of desperation among the sufferers of rare diseases and the physicians treating them that they could not get the attention of the large pharma companies. The Orphan Drug Act was a piece of legislation that was put in place in the US in 1983, and it arguably has had a tremendous effect on incentivizing companies to develop products for rare diseases. Before '83, in the decade before, about a handful of medicinal products were developed for rare diseases. In the last 30 years, 400 products have been developed for rare diseases. The Orphan Drug Act tries to help. It tries to incentivize the companies to develop products for these diseases. 60 or 70% or even more of these diseases are genetic diseases. And genetic diseases very often affect children at a very young age. And very often the diseases are so severe that the children will not survive into adulthood.
Founded in 2009, Orphazyme APS is on a mission to improve the life of patients suffering from some of the most devastating of these rare diseases.
Orphazyme was founded on a pioneering piece of science done by world-leading scientists in the field of heat shock proteins. Literally taking research from the academic lab bench and put it into a company where we would try to apply this to develop new and innovative treatments for rare diseases. We've moved our projects from bench side through preclinical studies into clinical studies, and we are now today starting our phase 3 clinical study in patients suffering from a genetic disease called Niemann-Pick disease type C. A phase 3 clinical study is the last clinical study before a medication is approved for the treatment of a disease.
Orphazyme's proprietary, innovative technology aims at mobilizing one of the body's own major cell protective systems, an intricate signaling network called heat shock proteins and their partners that act as nature's own chaperones for the proper function of proteins.
At Orphazyme, we work with the body's own defense systems. In particular, we work with a system called heat shock proteins, which has naturally evolved to protect us against different disease states. That can be diseases that arise from protein misfolding or from mutations within our DNA, and which then give cause to a variety of diseases.
Orphan diseases are in fact very different from each other, as they all have their own single mistake in a gene. But there are some common things in these orphan diseases, which are also common for non-orphan diseases, including Parkinson and other common degenerative diseases, is that the defense mechanisms of the cell fail in the end. So if we can lift them up, we believe that basically similar therapies could be used for very different diseases.
The problem with orphan diseases, where you have these inborn errors in your DNA, is that the body never recognizes this as a foreign disease, that is something it should react to. Thus, we need to nudge the system a little bit to let it understand that we are in fact dealing with a disease that the body should have perceived and should have reacted to, but it doesn't. So by gently nudging and manipulating this system, we're bringing the body's own awareness back that there's something here that's wrong and it should address.
By improving the body's own capacity to deal with many of these orphan diseases, Orphazyme seeks to transform the understanding and treatment of these rare diseases.
By understanding orphan diseases and the molecular biology of the orphan diseases, we can also apply that knowledge to much larger diseases. One current example is one of the diseases we are studying in Orphazyme, which has major implications for Parkinson's disease as well. The same mutation that has arisen in the orphan disease, and which we thus can study in this rare orphan spectrum, is also a major risk factor for developing Parkinson's disease later on in life. So in fact, by making a therapy that can be used for the orphan disease, we are also starting to grasp a phenomenon that could be used to treat Parkinson's disease.
The scope of Orphazyme is rather special, as it aims at finding treatments for very rare diseases, very few patients who've been probably forgotten by the medicinal industry until now. So that is, of course, a very rewarding task to be part of.
We believe that our approach can be used to treat not only rare diseases but also larger diseases such as Alzheimer's, Parkinson's, ALS, and so on, diseases that affect millions of people today. But that said, we also believe at Orphazyme that even the small diseases are as meaningful to develop treatments for as the larger diseases. Obviously, we do many things very differently in a small biotech company than in a large pharma, mainly due to limited resources. But we have, and I think many small companies have, made a virtue out of necessity, in that we have to be and want to be very inclusive. Out of necessity, we have to work closely with patients and with the leading scientists out there in the academic society. And it is a very gratifying experience because you interact so closely that you feel you're developing a treatment for a patient and not for a disease per se. We do believe, in our company being a small company, that it is as meaningful to develop a treatment for a small disease as it is to develop a treatment for a larger disease, especially if you can have a big impact on the patient's lives.
For more information, visit www.orphazyme.com.
Thanks for tuning in to another exciting episode of Innovations. I'm Ed Begley Jr. See you next time.
The preceding program was brought to you by DMG Productions.